Hello. This is Dr. TJ Ahn. In this episode, I'm going to talk about 3 pillars to bulletproof your private practice during this post-pandemic and new normal arena.
Welcome to the Podiatry Profits podcast, where you will discover how to get more patients and multiply the profits of your practice with minimally invasive foot surgery, proven marketing systems, and ethical influencing to your patients. And now, your host, board-certified podiatrist, best-selling author, speaker, and founder of TJ Ahn Coaching and Consulting, Dr. TJ Ahn.
All right, so what do I mean by 3 pillars? Actually, I'd say 4 pillars, but I want to make you feel more light. If I say more things, more pillars, usually, we get kind of scared and afraid of taking any action. But it's actually based on the hybrid concierge system. I developed this system on my own practice since 2016. So it's been 4 years. But actually, a funny thing that during this COVID-19 and pandemic and post-pandemic, I realized my system works even better in these tough times. So that's why actually I decided to create a podcast to help my colleagues who are podiatrists, because I see a lot of them are suffering and they're in fear. They're afraid of unknown future. But listen, what are you gonna do if things don't go back to normal as fast as you want it? Because the future, nobody knows about the future. But anyways, guys, if you're a podiatrist, you'll know exactly what I mean. Even before pandemic, what was our healthcare climate? It's so ridiculous. Past about 7-8 years, reimbursement has been going down every year, and patients' out-of-pocket portions going up every year. And, the cost for doing surgery or procedures at the surgery center or hospitals, they go skyrocketing, and hospitals really don't want surgeons to perform surgeries, and especially utilizing hardware fixation, internal fixation, etc. A hospital has to pretty much observe that cost, or patients have to pay out of pocket. So in result, surgery numbers are down, reimbursements going down, your practice revenue has been going down even before pandemic. So that's why, again, I started my that new practice system, hybrid concierge. But again, this episode, I'm not going to so much focus on hybrid concierge, because even if you decide to continue taking insurance plan, which still I don't advise you to, but again, it'll take time, I understand. You will need to listen and consider these 3 pillars that I'm going to talk about in this episode. So are you ready? So first pillar is niche and offer. Niche and offer. Some people pronounce niche. So, whatever you like. So niche and offer. So what is that? So that's my first pillar. You need to differentiate yourself, right? You understand that marketing advantage, competitive advantage in this market space. By the way, a lot of doctors consider themselves as a physician and surgeon, which I get it. However, if you run private practice, you have to implement your practice, run your practice as a business person as well. You cannot have a successful practice if you only focus on your medical expertise. You need to develop other sides. But anyways, that niche meaning something unique about you, something that can differentiate you by patients. But you have to start from you. You cannot become successful as a generalist. So what I'm saying about generalist, you are, probably podiatrist. General podiatrist, you cannot survive. There are enough of them. A lot of, as you know, nurse practitioners and physician's assistant now, they're going to have a full license. So to reduce typical healthcare cost, a lot of routine foot care and a lot of general foot care will be taken care by nurse practitioners and physicians, PAs. So in order for you to have that unique angle, you need to develop niche. Make it simple. I'll give you an example. My unique niche is minimally invasive foot surgery. I am only focusing on minimally invasive foot surgery. That doesn't mean I don't take other foot problems. I still do. I still, do see heel pain, fungal toenail, warts. However, I want you to start thinking about what can you differentiate yourself? What would you like? What makes your heartbeat going? What makes you excited? So for me, it's minimally invasive foot surgery. So that's why my niche is around minimally invasive foot and ankle care. Now, I want you to create your own niche in terms of uniqueness, okay? Then offer. Well, I'm not talking about real estate offer. I'm not talking about, other like products offer. Our service industry, because don't forget, we provide services, right? So we are a service provider. Now, we offer our service, but most doctors think service as CPT code, CPT code, right? But I want you to start thinking differently. Our offer needs to have core service, which you typically think with CPT, plus something extra. Something that can create and supplement that VIP experience around your core service. So niche and offer that creates experience for patient. Experience for patient. So that's different than just CPT, okay? So that's my first pillar that I advise you to start considering seriously if you want to navigate through these tough times and bulletproof or future-proof your practice without hurting your practice revenue or profits. Now, second pillar is lead gen marketing. Lead generation, medical marketing. Okay? So you need to know the difference. There are many different categories of marketing. Lead generation marketing is about acquiring new patient leads, not just the branding. Okay? So lead generation or patient acquisition marketing is very targeted strategy and tactics involved. So either you do it or you need to delegate this type of lead generation marketing to capable marketer who knows what we are talking about right here. So in order to generate leads, you gotta use the internet, the modern technology, right? There Google, search marketing, Facebook, social media marketing, Instagram, which is still owned by Facebook, YouTube. It's still considered as video search marketing, but YouTube, as you know, is owned by Google. So if you're not utilizing social media strategy and tactics, you're missing out. Now, again, your ultimate goal is to become independent of insurance network, and you set the terms, you set the pricing, you set rules and regulation. You're the captain of the ship. That's the idea of your modern private practice. I always talk about this in a Facebook Live or YouTube channel, that whenever the environment changes, guys, you need to adapt your practice, your mindset, your strategy and tactics to a new environment to survive and thrive. It's that survival of the fittest, like Charles Darwin, right? Evolution. You need to transform your practice. You need to adapt your practice to new environment in order for you to continue to be successful. So the lead generation marketing, it utilizes what they call pixel or tracking. So it's totally ethical way of tracking your potential patient's behavior. So once you start utilizing these pixels and tracking technology, you'll be able to show your advertising or marketing messages to your potential patients in very targeted manner. And by doing so, you will be able to reduce the marketing cost, because you'll be using this technology to target specific audience. For example, who watched your videos, who has been to your website, who has seen your certain messages. You can track as specific as you want. So by doing that, your chance of acquiring these patients who might be interested in your service, you'll be able to get them to your door. So that's the leads generation marketing, which is second pillar. Now, third pillar is the ethical persuasion. That's what I call ethical persuasion. It's essentially your communication skills with your patients. You see, most modern physicians, typical insurance-based trained surgeons, they don't want to talk about money with patients. It's a big problem. Whenever patients ask money question, doctors feel uncomfortable because you feel like you're not meant to talk about money. You're meant to fix patients' problem, which is totally true. I totally get it. I see where you're coming from. But again, I've trained many surgeons. I wasn't comfortable at the beginning, so I invest in myself in sales training, ethical persuasion training, mastermind group. I practice, so it's a trainable skill, learnable skill. I'm not telling you to become salesman or saleswoman. Don't get me wrong. You are a still surgeon and physician. I need you to know that ethical persuasion is the communication skills. So you help your patients make decisions about their best treatment solutions for their specific problems, not biased by a money issue. On your own head, by the way. Most patients, they don't want to choose the second best solution. Put yourself in that situation. If you have disease or condition, and if your doctor that you trust says, well, first and best and the best solution is too expensive for you, so I'm not going to provide you the first solution, but here's a second best solution. Would you like that? Think about yourself in that situation. Would you really like that? I wouldn't. Think about it if that's for your children, if you have children or your loved ones. If doctors suggest second best, third best, because doctors think you're not able to afford that solution. That's ridiculous. we are morally obligated to provide the best treatment solutions for their problem. Don't you agree? I feel morally obligated. So money could be in the way, but it is, start thinking about that money is a just simple means of exchange of your service with your patients. That's it. Don't even hesitate. Don't even run away from that. I know it takes special training though. I do. Because I've trained many doctors in my coaching programs and my private clients. I have a specific system to train, my clients to get over that fear of or uncomfortableness of money. It's a big obstacle, big mindset block we need to break through. So far, first pillar, niche and offer. Second pillar, lead generation, medical marketing. And third pillar is ethical persuasion. Now, all these three pillars, I said earlier, it's really 4 pillars. So that fourth pillar, if you may imagine this, these 3 pillars I mentioned today being like each corner of a triangle. Okay, if you think about, imagine, like visualize triangle, niche and offer, 1 point, medical marketing, lead generation marketing, second point, and then the ethical persuasion, third point. That triangle right in the middle, create a little circle, and that is mindset shift. You need to develop 7-figure mindset shift. Again, it involves that money, limiting beliefs about money, limiting beliefs around yourself. A lot of doctors, for some reason, past 10 years, I believe they develop this, their own mental block. I'm not good enough. I don't deserve this. That type of thing. We've been brainwashed. We've been brainwashed by system, insurance system, healthcare system, and also your surrounding environment. Could it be your own family members? Could it be your very close friends? They don't want you to try something different. You know why? Because they haven't done it. Let's face it, if they stop you from what you're trying to achieve or break through, if they're stopping you, and look at them, usually they haven't done it for themselves. They don't want you to risk. They don't want you to go through. They don't want you to take action. So a lot of aspects in this mindset shift, it's a core foundation, to be honest. But again, those 3 pillars are more visible, seems more, feasible for you to do. But whenever we talk about mindset, people kind of start worry about it. Oh my God, what do I have to do now? Change my mindset. I'm normal. I'm okay. That's all kind of denial. Okay? If you're okay currently, then then we have no room to improve. If your cup is full right now, we have no room to improve any further. So why are you even listening to this show, But I know you're listening to this show because you know deep down that you deserve better. You deserve financial wealth. You deserve to be successful enough to provide support and stability for you, your loved ones, and your family. So in order for you to do that, if you're continue to doing the same thing over and over every day and expecting something different, there's a quote, that's the definition of insanity. You're expecting something different, yet you're doing exactly the same thing over and over every day. So 3 pillars, and in the middle, core mindset shift that will break you free from this nonsense healthcare system, that will make you achieve your dream. That will help you improve, build, and navigate through this post-pandemic and new normal arena, this new normal era. You need to adapt yourself to new environment. So I provide you in this episode 3 specific pillars and core mindset shift that will make it possible. So I hope you enjoyed this episode. And again, I'm so glad that you're listening to this podcast. If you like to hear more about specific strategies and tactics and mindset and productivity tools to, help you improve your private practice, soar with private practice profits and revenue, subscribe to this podcast channel so you will not miss my future episodes. Again, I'm glad to have you. If you have any questions, contact me directly. And I am so looking forward to seeing you at the next episode.
You've been listening to the Podiatry Profits podcast with Dr. TJ Ahn. To find out more about Dr. TJ Ahn or discover how you can grow your podiatry practice, visit drtjahn.com. Or you can also get a free copy of Dr. Ahn's best-selling book, Opt Out: How to Take Back Financial Control of Your Private Clinical Practice Without the Hassle of Insurance Companies. Just go to optoutbook.com.